Hello. Hello again, and thank you for joining us today. Welcome to 2021. I'm Bob Continetti, Senior Associate Vice Chancellor for Academic Affairs, and I'm going to be the moderator for today's town hall. Today we have a group of panelists to provide some updates on our operations during the COVID-19 pandemic and to answer your questions. Excuse me one second. As before, we have been taking in questions, and we will be answering those during the Q&A session. And we encourage you to also use the Q&A window to submit additional questions for our panelists. Due to the time limitations, we're not going to be able to get to all the questions today, but we will log them as they come in and post the answers on the Return to Learn website, which is returntolearn.ucsd.edu. It's going to be posted in the chat. The webinar also has live closed captioning available in two different ways. First, you can click on the closed caption button at the bottom of the screen and select Show Subtitles, or you can also click on the link that is pasted into the chat. So that is being pasted into the chat for us. Now, I'd like to introduce our Chancellor, Pradeep Khosla, for some welcoming remarks. Chancellor Khosla.
Thank you, Bob. Good afternoon and welcome everybody. Welcome to the first webinar of the year 2021. I hope you had a relaxing vacation or holidays, and Happy New Year and welcome to the new year. When we left last year in 2020, when we finished the fall quarter, I think it would be reasonable to say that we finished on a high note. We had taken a whole series of precautions and put mitigation strategies in place that would limit the infection rate on our campus, and that's exactly what happened. Our campus infection rate, positivity rate, was between 10 and 20 times lower than the positivity rate in the community. We also knew at that time that coming back for the winter quarter, the students would be going home and coming back and bringing a lot more infection than we had seen on campus, and that's exactly what we are seeing right now. We're in the first 7 or 8 days of the move-in process, and if you go to our dashboard, you will see a lot higher positivity rate as compared to the fall quarter. And the reason is that people went out, they're coming back, and we are detecting more positives. But we have a much stronger testing regimen in place. Now the testing strategy is once a week, and we have vending stations, about 11 of them spread out all over campus, and they're being used very effectively. So I'm personally very positive about the way we are going about mitigating the risk, managing the risk, and I'm confident that this quarter would be higher rates than the last quarter, but nonetheless much lower than what the community is seeing out there in the community. And I can tell you in all of this, the real differentiator is the behavior of our students. They have done extremely well. I cannot be more proud, and I say hats off to our students for being responsible, for knowing what it needs to be to keep this as a safe environment. Now, in the meantime, sometime starting mid-December, we've also been vaccinating people. The vaccines are here, and our hospital has put together a strategy in place to vaccinate people. And the first group, quote unquote, group 1A, is being vaccinated right now. And I'm told that we are doing reasonably well, or really well, as compared to others. Well enough that the county came to us asking for our help in vaccinating the broader community in the county, doctors, dentists, people who are not part of the hospital system, but nonetheless are healthcare providers. And so yesterday we unveiled a program to vaccinate 5,000 people per day, starting with Group 1A. And today is the first day that this is happening. It was a collaboration between the county health department, UC San Diego Health, Patty Mason led this effort, and the Padres, and a whole bunch of other players. So I'm very excited about it. So as I look at this winter quarter, like I said.
Town Hall, UC San Diego Executive Vice Chancellor, Elizabeth Simmons. Elizabeth.
Thanks very much, Bob. It's a great pleasure to be here with everybody for the first Return to Learn Faculty Town Hall of the new year, and coming together as a community to discuss issues of common concern and impact is even more important than ever in these rather tumultuous days. So I would like to start by thanking our faculty for ongoing support of our students and other colleagues. Your dedication, flexibility, and compassion is essential to our Triton community, especially in these challenging times. I'd also like to just share a quick reminder that academic reviews are proceeding on schedule. The Senate and the administration join in encouraging all academics to include a self-evaluation statement outlining how COVID-19 may have impacted your work. Please include that in your file. Details like this provide very helpful context to reviewers. Now, we have several presentations today, and our panelists will be looking forward to answering many of the questions that participants have submitted in advance, and as many as possible of those that you'll write into the Q&A as well. And so now I'd like to turn to Senate Chair Stephen Constable to say a few words before we start the program.
Thank you, Elizabeth. Welcome, everybody. I'd like to say Happy New Year, but I have to be perfectly honest and said the year's got off to a pretty rough start. However, thanks to all your patience, hard work, and resilience, we continue to teach our classes and do our research. And UCSD as a campus is in pretty good shape compared with many other universities. The Senate continues to do what it can to help faculty and students. Next week, Representative Assembly will vote on a slate of limited term exceptions for the 2021 winter and spring quarters, extending pass no passed options, as well as deadlines for withdrawing and changing grade options. We do not do this lightly, and the Senate remains concerned about unintended consequences, but students made a strong case that this was needed to alleviate stress and anxiety. I've been asked to remind you, as Pradeep said, that all employees, including faculty who report to work on campus, are required to get COVID-19 testing on a weekly basis unless they've had COVID-19 in the last 90 days. Testing is an important component of our multi-layered defense against the virus. The vending machine test kits have received a great reception, and there's a nice video on the Return to Learn website showing how to use these. So hang in there, everyone. The tunnel may have got a little longer and darker with the upsurge in community infections and the hiccups with the vaccine rollout, but there is still light to be seen at the end. So with that, I'll hand it back to Bob Continetti.
Thank you, Dr. Constable. I would now like to introduce our first presenter today, Dr. Chip Schooley, professor in the Department of Medicine, and he'll be joined also by Dr. Natasha Martin, associate professor of medicine. They're going to brief us on the current state of the pandemic, discuss vaccine distribution plans, and other aspects of our efforts to control the pandemic here at UC San Diego. Chip?
Thanks very much, Bob, and welcome everyone back from our winter break. I'll be relatively brief about the state of the pandemic. It's very hard to turn on and off the television without being updated continuously, but the bottom line is we're in the midst of a surge globally in the US and in California. You can see now that we've had a cumulative number of 90 million cases in the world, and about a quarter of these are in the US, and about over 10% of these are occurring in California. The death rate continues to clock up. We've lost about 30,000 fellow Californians and almost 2,000 people here in San Diego to this pathogen. Next slide, please. California continues to be the place where the cases are accumulating most rapidly. This is kind of the daily case rate, and you can see that with the exception of a short dip, we're headed back up again, and we will likely see ongoing surging of this epidemic for at least a couple more months unless things change drastically, and there isn't really right now much evidence that will occur unless something in terms of masking and some of the non-biomedical interventions comes to bear in a much more effective way while we wait for the vaccines to kick in and begin to help us out. Next slide. Now, this is the county dashboard, and the only two things I want to point out here are that we're now at a state in which our case rate is at 50 cases per 100,000 as a 7-day average. And that's remarkably changed from where we were back just before the beginning of November when we were hovering around 7 cases. We've seen a surge that has continued. Hospital capacities are extremely stretched, including ours, and it's a battle every day, I think, to deal with this virus from the health perspective. The positivity testing rate in the county, which was down to 3% for a while, is now up to 16%, which means that 1 in every 6 tests that people are taking is now positive, which is the kind of testing rate that we were seeing in Arizona and other states over the course of the summer. Next slide. Now, I want to say just make a brief comment about this new strain you've been hearing about. To put some of this into perspective, you've been hearing about the so-called spike deletion mutant, or the British mutant. It's a bit of a misnomer because actually there are multiple mutants that share many of the same mutations that have an impact on the viral biology, which is in turn having an impact on the virus epidemiology. This three-dimensional cartoon shows you the 6970 spike, the bottom right red dot on this diagram. Changes the configuration of the spike that the virus is very important from the standpoint of virus infectivity. It increases the rate of viral replication by about 2-fold. There's also an area up at the top, position 501, that increases the strength of the binding of the virus to its receptor. These 2 changes in particular have given the new virus an opportunity to outgrow the old virus. And it has had a very negative impact on the epidemic. We have this virus here in California. In fact, we've had about 28 cases so far identified in San Diego County, primarily by Christian Anderson at Scripps. And this is really just the tip of the iceberg. The vast majority of the current spike in the epidemic, however, is not caused by this spike deletion mutant. And I raised this only to make the point that the stakes are very high for us to double down over the short term, because this will make it even more difficult to control. There's no evidence at present that this virus evades the vaccines that are out there. The vaccines will help us, but we have to get everybody vaccinated first. Next slide. Now, what about vaccinations? You can see compared to Israel, the US is not doing very well. And this is true really around the country and in California as well. The complications in getting the vaccine rollout going have included logistics. And these aren't logistics, all the fancy efforts of FedEx and UPS and airplanes flying around the clock. It's logistics getting the vaccines from where the airplanes are landing into people's arms. The 2 vaccines that are currently approved are ones that have complex cold chain requirements. We've gotten very complicated and formal in our prioritization system for vaccinees. There's a big bureaucracy in place to make sure second doses are available before people get the first dose. And we have a healthcare system that obviously is quite difficult to move things rapidly through. And this we did and thought we would. We have a large surplus of vaccine waiting to go in people's arms that is backed up behind the rollout that we've seen going on since the 3rd week in December. Next. Where are we at UC San Diego? UC San Diego Health, as Chancellor Khosla mentioned, has been rolling out the vaccine extremely effectively, initially with 2 vaccine sites, one down at Hillcrest, one in Thornton, very well organized, rolling people through at a rapid clip, and has managed to get through a large fraction of the patient-facing healthcare workers and is pushing hard to get this finished. The uptake of vaccine has been really quite high. Almost everyone who's been offered the vaccine has signed up for it. And I think this is very good because these vaccines are extremely effective and we expect them to have a big impact in terms of preventing infection once we get everybody vaccinated. Once we get through the healthcare workers, also in phase 1A, there's a typo here, my fault here, will be people who are over 75 and who've gotten healthcare within the UCSD healthcare system over the last 3 years. the members of the so-called essential workforce. There is a task force on campus that is working on defining this. This will mainly be people who are police, fire, first responders, daycare workers, and will be mixed in with this 75+ group. We will be vaccinating people who have gotten care from us, people who are within our workforce, for the most part, will be getting vaccinated by their own health systems if they don't get care from others. In other words, Kaiser will be providing vaccinations to people who receive Kaiser healthcare if they are employed by us, except for a couple of categories of people in the essential workforce. As additional tiers are opened, people who are UCSD patients will be contacted through MyChart. So you should update your MyChart and be ready to receive notification from vaccination. As you also heard from Chancellor Khosla, we are working with the county to rapidly expand vaccine access in the community with the super center that has been opened today at Petco Park. This initially was opened in collaboration with the county to help catch what we would call the straggling healthcare workers. These are people who are not affiliated with large hospital systems and who need to be vaccinated as part of the healthcare workforce. Once these are done, then the plan would be to move on and vaccinate people on other priority tiers. I didn't bring a list of the priority tiers for a couple of reasons. First of all, they differ from state to state, and secondly, it's all very fluid, and we may see things change. There is a website on the there's a vaccine website on the RTL cluster of websites on the Return to Learn public-facing information scheme that will be available and is available now that will keep you up to date about all of this. But please keep in touch with us about vaccines as we move along. The biggest rate limiting feature once we get the logistics of vaccination out there taken care of is going to be vaccine availability. Next slide. And right now we have 2 vaccines that have received emergency use authorization from the FDA. And what this means is that although not fully approved for commercial sale, they can be used under emergency use authorization because they meet an unmet medical need. And the benefits are felt to outweigh the risk. That's the definition of emergency use authorization. The first vaccine to be approved was the so-called Pfizer vaccine. It's a vaccine put together by Pfizer and a company called BioNTech in Europe. It and the Moderna vaccine, which was approved a week later, are both messenger RNA vaccines. These are new technologies that we think will revolutionize vaccine production in the future and have been used actually over the last 8 or 10 years in other vaccine research programs, including rabies vaccination and CMV vaccine. And these vaccines work, they just haven't been commercialized. So although people talk about it being really, really new, there is experience with messenger RNA vaccines and other diseases. These 2 products are the ones that are currently available in the US. Both companies are struggling to make as many doses of vaccine as can be made. The rate limiting feature for them to some extent is raw materials. The RNA building blocks needed to make the messenger RNA vaccine. The US government has finally weighed in to push suppliers to make provision of RNA and other building blocks for these vaccines available to the manufacturers to allow manufacturing ramp up to be accelerated. There are 2 other vaccines in the wings that will have a significant impact on vaccine availability, assuming their initial phase 3 trial data look to be in the same range of success as the Moderna and Pfizer vaccines, both of which have a 95% protectiveness on preventing symptomatic disease and almost 100% protection against severe disease. These 2 vaccines are in phase 3 trials. We expect to hear something about the AstraZeneca vaccine in the next couple of weeks and the Janssen vaccine not too long thereafter. When the data are available, they'll be presented to the FDA and a decision will be made about adding them to the US vaccine inventory. If they become available, I think there will be very little between us and being able to vaccinate almost the entire population by summer if these two move forward. There's another vaccine that's a bit further down the road. It too is going to be easy to make, just like the Janssen and AstraZeneca vaccines are. None of these three will require a lot of complicated cold chain gymnastics. So I think when we get to this, vaccines will be much more widely available, which is a good thing. I'd like now to turn to Dr. Natasha Martin, my colleague on the Division of Infectious Diseases, who has provided the mathematical framework in which the Return to Learn program has been developed, who's going to talk to you today about the wastewater monitoring program. Dr. Martin.
Thanks, Dr. Scully. I'll just take 1 minute to discuss the current status of our wastewater monitoring program. So as you are hopefully aware, individuals who are infected with SARS-CoV-2 can shed virus in their feces early on in infection, and we can actually detect that virus in the associated wastewater coming from those buildings. And so we have a very ambitious wastewater monitoring program, and the intention is for it to provide us an early signal and an early indication that one or more individuals may be infected in an associated building on campus, and to encourage the people that are living or working in those buildings to seek testing so that we can detect the virus early and prevent transmission to other individuals. So at the moment, you can see here on the left, we have 70 samplers placed. Those are the samplers in green. They cover about 234 buildings on campus. The vast majority of those buildings are residential buildings. And we are in the process this very moment of placing an additional 66 samplers, which are focused on covering our non-residential buildings. So these are primarily research buildings and administrative buildings, so that we can expand coverage to those populations. And the overall goal is that by the end of winter term, we should have 200 samplers at various manholes across the entire campus in order to really provide full coverage of this wastewater monitoring program. You'll see on the map on the left-hand side that our samplers cover both main campus as well as Scripps. And so we, especially in this new phase of non-residential buildings, plan to expand coverage across all of those areas of campus. At the moment, when we have a positive wastewater signal, we're sending either a public notification if the buildings associated with that sampler may have public areas, but we also have been shifting more to local notifications to the individuals who are actually resident or working in those buildings to get a more targeted message and ensure that the people who are may be truly affected by these signals seek testing. We are quickly moving towards providing this information on our daily public COVID dashboard. So within, hopefully by the end of this week, you should be able to go to the COVID dashboard, locate the building that you work in or that you live in, and see its status every day. So that will be broadly available. Next slide. And just one quick point about the wastewater program. So we've seen now, if we look at the data that we collected over the course of last term, we can see that it's actually incredibly sensitive at detecting infections. Over 70% of the infections that we detected in buildings that were associated with a wastewater monitoring program in the fall were detected early by our wastewater monitoring program. And 50% of those infections were actually, those individuals were diagnosed within 3 days of our wastewater notification, providing us information that both this system is very sensitive and that also our alerts are encouraging people to get tested and diagnosed, therefore reducing transmission. So now I'd like to pass it back to Dr. Continetti, and happy to take questions later on. Thanks.
Thank you, Drs. Martin and Schooley. Next, we're going to hear from the Executive Director for Housing, Dining, and Hospitality, Dr. Himlata Javeri. She'll tell us about how the winter move-in process for our students has proceeded. Himlata.
Thank you, Dr. Continetti. As Chancellor Khosla had indicated, our students left for a brief period over winter break and have now returned back to campus. Our on-campus housing and dining services remain operational with the preventive measures that we put in place for fall quarter, which includes we continue to remain at single occupancy for both undergraduate and graduate students. For winter quarter, our approximate total number is 10,000 residents, which includes our undergraduate students, graduate students, and also includes the partner and children that live with us. Our numbers are almost exactly the same as the fall quarter. So we have the same number of undergraduate and graduate students continuing to live with us for winter quarter. For dining, for our undergraduate students mainly, we will continue to offer it through a to-go model. It is through our Triton to Go app. Our students love it. Majority of them use it, over 90%. We never opened indoor dining for the fall quarter, and indoor dining continues to remain closed on campus. The priority for on-campus housing is to make sure that we meet the needs of our students, but really making sure that all our decisions are led by health and safety concerns for our students, employees, and our local communities. With that, again, happy to take questions in Q&A, and back to Dr. Continetti.
Thank you, Dr. Javeri. Next, we're going to hear from Associate Vice Chancellor for Education and Innovation, Carlos Jensen. He's going to tell us about outdoor classrooms and winter and spring instruction updates. Carlos.
Thank you, Dr. Continetti. And thank you for having me to give you this quick update. So given the state of the pandemic and current restrictions, the number of in-person classes this term have been reduced quite significantly. We have a little over 200 graduate and undergraduate sections that are being offered in person, or that will start to offer in person once current restrictions are lifted. The current state and county orders prevent indoor in-person teaching, but do allow for outdoor teaching, and they do allow for teaching in the medical and the pharmacy areas. Currently, about 10% of our graduate students are taking some in-person classes. That includes in-person research through Return to Research, and 8% of undergraduate students are taking one or more classes. Next. As we've shared multiple times already, the outdoor classrooms are in full swing. At the end of fall term, we shifted about 22 sections to using the outdoor classrooms. This was to let them finish out the term in person. For this term, we have the 4 teaching classrooms that are currently available pretty much at capacity. We have about 70 sections currently scheduled there, and we're trying to squeeze in as many people as we can. In addition to that, so those 4 classrooms are fully equipped, as we've shared before, lit, Wi-Fi, speakers, displays, Zoom capable, tracking cameras, all that, the usual things that we've become accustomed to. And we are, as quickly as we can, building 2 additional tents at the southern end of Library Walk, and that's next to the Career Center and Center Hall. And those will be available by the end of this term, and probably in use through spring and summer as we wait for the vaccine to get rolled out. And with that, I'll turn it back to Dr. Continetti, and happy to answer questions at the end.
Thank you, Dr. Jensen. Finally, today we're going to hear from Vice Chancellor for Resource Management and Planning, Gary Matthews, about cleaning and safety in our facilities on campus.
Thank you, Dr. Continetti. Happy New Year, everyone. I too offer my appreciation and gratitude to our faculty, as well as our service staff who've been working since March to ensure a safe environment for all. What's clear is the pandemic has lasted quite a bit longer than we may have initially thought. And what we're reaffirming are some of the opportunities for each of us to take personal or make a personal commitment for our personal safety. So we are requiring everyone to conduct a daily screening, maintain physical distancing, please wear a face covering mask, limit contacts. Some talk about having pods. I think it's a great idea to do that. And with the new approach of distribution with the COVID-19 testing, we all should be doing it on a routine basis, particularly those that are working on campus routinely. There's return to work training that's available, that's really required before you return to campus, as well as just a general requirement to pay attention not only to the current signs, but they change from time to time. Next slide, please. Consistent with what we've talked about in the past, that facilities management building services continues to clean on a routine basis. Our custodial services have heightened their disinfecting of high traffic areas, restrooms, and classrooms. Electrostatic sprayers are used to sanitize campus buildings, allowing for 100% surface disinfecting. This has certainly been a learning process for all of us, but we're at a point where we have begun to identify new equipment and new methods of cleaning, and even the use of hand sanitizers. We've installed 1,500 throughout the campus to ensure that people have an opportunity to wipe those hands and to do it on a routine basis. We've also talked often about the buildings and the retrofitting of our air handling systems, and the slide points to 90% of our campus buildings are now retrofitted. And what should be noted is that the remaining 10% simply will not accommodate those upgraded filters. So we're doing other things to make sure that the air quality within those spaces is as highest level possible. What's also happening is Dr. Jensen mentioned the tents. The tents were constructed and designed, and most importantly, erected so that they met the highest standards of sanitation, that they provided high levels of airflow, as he just mentioned, but also ADA requirements were met wherever we could, so that we would make sure that we were able to provide a healthy, safe environment for everyone. Next slide, please. We've had several of these sessions with faculty and staff through the months, and what was clear is that there was a need to basically close the campus to the general public. So since we last met, I think we've become a little more focused on making sure that only folks that are engaged in essential campus operations or business should be on the campus. One of the things that we all can do to help each other is to make sure that we don't prop doors open. We found people in buildings who did not belong. And because of the limited number of folks on the campus, others who might want to prey on the campus and shop without paying have been found in buildings where they didn't belong. So all exterior restrooms of the buildings are accessible between the hours of 6 a.m. and 8 p.m. And then these restrooms are secured during the weekend. Building exterior doors are open between the hours of 6 a.m. and 8 p.m. during the week, and they're secured at other times. If you need an escort, and if you're working in a building later from sunset to sunrise or after 1 a.m., we've addressed options for you and developed options for you to ensure that your safety is accommodated. I would be remiss if I didn't talk about the ongoing concerns for campus-wide safety as it relates to political activities. We're monitoring the inauguration in terms of safety for the region. There was a demonstration and a counter demonstration over the weekend in Pacific Beach, and that event had been pre-scheduled before last week's events. So we're monitoring not only the health and safety, but also the political activity and movement to make sure that we provide the campus, all of you, the safest environment possible. Next slide. I think that's returning to Dr. Continetti.
Thank you, Vice Chancellor Matthews, and thank you to all the presenters today. Now it's time to move on to the question and answer segment. So I invite all the panelists, including Deans Moore and Anthony to turn on their videos at this time, and we'll begin the Q&A. As before, during registration, attendees have had an opportunity to submit questions for the panelists to answer. We've selected some of the most popular questions for the panel today, and we'll be beginning with those. If you have a question now, please use the Q&A window to submit those questions during this session, and our panelists will do the best to answer them live. Due to time limitations, however, we may not be able to get to all of your questions today, and we'll do our best to post the answers in the FAQ on the returntolearn.ucsd.edu website. So with that, our first question goes to Associate Vice Chancellor Jensen. And Carlos, the question is, will large courses have the opportunity to have study sections in person?
Yes, large courses have that opportunity, just the same as small courses. Right now, those have to occur outside, so using either the teaching tents or the study tents, but we have to be creative in terms of strategies of breaking large classes up into individual recitation sections or smaller groups to keep everyone safe.
Thank you. The next question is one that we would like to be addressed both by you, ABC Jensen, and also by Senate Chair Constable. And that question is, for future classes in the post-COVID-19 era, will instructors be allowed to retain successful remote learning components in their course delivery?
So every cloud has a silver lining, and as difficult as this period has been in terms of teaching and in terms of effectively connecting with our students, I think we've also learned some new best practices, and absolutely we will have the opportunity to bring those forward with us as we transition out of the current restrictions. Faculty have broad discretion in how they structure and teach their classes. Dr. Continetti, Dr. Constable?
Yes, that's right, Carlos. You can pretty well do what you like as long as 50% or more of your classes are in person. And if you'd like to consider reducing that, the campus and the Senate will welcome proposals for approval of our classes. And the Senate and administration has got several committees and work groups that are looking at lessons learned and how going forward we may want to incorporate that into our teaching strategy.
Thank you. Now we have a series of questions regarding the vaccines for Dr. Schooley. And, the first one is, Dr. Schooley, will UCSD administer vaccines to faculty, staff, and students? If not all, which ones and what order?
We're gearing up to do that. We will start with people who receive their health care here, and there are efforts to open up vaccine stations on campus, including perhaps the Student Health Service. The nurses there are totally capable of doing that, and the infrastructure is there to do it. As we get to these tiers and start understanding the scope of what we'll need to have on campus, we'll be standing up sites to make it convenient for people to get through quickly. One of the things that's not completely clear, the teachers are part of one of the earlier tiers. What isn't clear is where university professors stand in that. I mean, university faculty, not just professors like Dr. Continetti. What isn't clear is whether they are considered the same as teachers K through 12. We think right now they are. We're not certain, but we think they are. But as we get to those tiers, what will happen is the county will say, okay, we're ready for tier X. UC San Diego Health will then allow people in those tiers to register through MyChart for appointments, and you'll be able to go to a vaccine station where they get vaccinated using MyChart. Other healthcare systems like the Sharp and Scripps and Kaiser will have the same process for people who work here but get care there. If things loosen up and they offer us vaccine for those people too, obviously we'd be interested in trying to make that available as well to make things less complicated. A new administration is coming, and I think one of the things that's been recognized is that the current system is extremely complicated, And we've let the perfect be the enemy of the good in terms of getting vaccine into people's arms. And if things are loosened up and made a little bit less regimented, we may well be able to open up the doors more broadly at an earlier stage. So pay attention to the website, because as I said earlier, I think things will be changing. For people who are in addition to people who work here, the health system is also going to be responsible for people who get their care here, but don't work here. And that will be starting with people over the age of 75 who are not in congregate living facilities. Those are already being taken care of by CVS and by Walgreens on contract. So this will be people who are in our healthcare system as documented in EPIC, again, called in by MyChart for vaccination, and then going down the list to younger people with pre-existing conditions in a hierarchy that will be specified by the state of California and then enforced by the county health department.
Thank you. And Dr. Schooley, the next question has two parts. First, will vaccination be mandatory for UC San Diego faculty, staff, and students? And secondly, will there be a cost?
The mandatory, right now, the vaccines are available under an emergency use authorization, and by law, EUA approved drugs, vaccines, and other instruments can't be made mandatory. What will happen after they're made widely available and commercially available, fully approved by the FDA, I don't think has been decided. We do have vaccination requirements for students for measles and for other communicable diseases, and where this one will fall, I think, is still not yet determined, although I think it would be hard to argue that this is not an effective vaccine against a severe pathogen, and it would be hard to advocate for measles vaccination and leave coronavirus vaccine off the list if it turns out to be as safe as we think it is. The faculty and staff are not currently on the mandatory vaccination list for the same reason. I think there are a lot of complexities in terms of making vaccines required of employees. We've seen this in every vaccine that's come along. Having said this, as someone who's received, as a healthcare worker, the vaccine, this is one of the safest vaccines I've seen in a long time, and one that I think is more effective than almost any vaccine out there. So I'd be hard pressed to make an argument that people shouldn't be lining up to try to get this vaccine as soon as we have enough of it. The cost, insurance companies will pay for the cost. I think the government is going to set up and make sure the cost isn't in the way of everybody getting vaccinated as this rolls out. So you shouldn't have a personal cost for being vaccinated.
Thank you. There's a follow-up question, and to some extent, I think you've addressed elements of this, but this is a matter of great concern to a lot of people, and that has to do with the timeline and the rollout plan and order for vaccine distribution for faculty, staff, and students at UC San Diego. Do you have an idea of what we're looking at with respect to the timeline?
You know, I think the biggest variable is going to be what happens with these two vaccines that are on the door of the FDA. If the AstraZeneca vaccine and the Janssen vaccine are approved for EUA, I think we'll see things really ramp up toward the end of this quarter. If we are still stuck only with the Moderna and the Pfizer vaccines, we're going to be at the mercy of their production, which is slower. So that's the biggest variable right now, and it's very hard to predict about what the data will be until we see it. The pattern so far has been this virus has been one that's fairly easy to immunize against, and let's hope that these two vaccines, which are not mRNA vaccines, but based on adenovirus platforms, are as effective. And if they are, then I think our vaccine supply will be close to limitless, and our vaccine tempo will be limited only by how much capability we have to get people through our system. We're committed to ramping up the personnel to do this in as aggressive a way as needed to meet the vaccine supply as it comes our way. So we're highly committed to getting it to everybody as fast as we can.
Thank you. And there's one more vaccine-related question. The first part of it, I think you have kind of addressed already, but the second one introduces a new idea, the idea of a vaccine passport. So here's the question. Can you clarify, will campus employees be vaccinated via the university or through their primary healthcare providers? And the follow-up is, if someone can verify via a vaccine passport app that they have received the vaccine, may they return to their regular schedule on campus?
The people, again, who work here can be vaccinated here. People in certain positions, for example, police and fire workers and first responders would be vaccinated here as part of the overall program. People in other types of jobs would first have their option through their own healthcare provider, but then if that isn't available, then we will find ways through the super center and other places to get people vaccinated. There would be no reason to have somebody be vaccinated elsewhere, not be considered as a vaccinated person here. So I don't think there'll need to be a lot of documentation about whether you've been vaccinated at Scripps or Sharp. What we're going to do as a society about, going back to so-called to normal, if you will, it'll take some time to get there because not everybody will be vaccinated at once. We won't know when you're standing in line at pavilions whether the person in front of you who's not wearing a mask has been vaccinated or just isn't wearing a mask. So I think that stores and businesses, and I hope we will continue to require people to wear masks until we know that the vaccine penetration is high enough to protect us as a population. We're also going to need to learn a bit more about whether these vaccines also prevent asymptomatic spread. We know that they're extremely good at preventing severe disease. They're very good, 95% effective in preventing symptomatic disease. There's only fragmentary information about whether people who've been vaccinated are less likely to shed virus than people who have not yet been vaccinated. In the Pfizer and the Moderna trials, there are some fragmentary data that was obtained by having people in the study just swab their noses at various times, whether or not they were having symptoms. And to make a long story short, it looks like the shedding rate is down by about 2/3 in people who are on the vaccine as opposed to the placebo arms of those trials. So it does look like the vaccines decrease but don't eliminate shedding. The amount of virus in those swabs, the quantitation has not yet been done, so it's not clear whether the shedding that was done in the vaccine arm may have been low enough that it's not likely to transmit to other people. We'll know those things over the course of the next couple of months, and I think that'll inform public policy about issues about returning to full campus density, masks coming off, and opening up some of the things we've had to close down.
Thank you, Dr. Schooley. We're very fortunate to have your insights into these pressing questions. Next question goes to EBC Simmons. And EBC Simmons, is there a threshold rate of infection that would send us back to remote instruction only?
I think it's a two-part question about that and whether there are triggers that would lead us to roll back our in-person research levels. And I'd like to answer it all together. So we are guided by county and state health orders in determining which activities are permitted on our campus, in which modalities, at which occupation density for rooms, and so on. So even now, in the most restrictive situation that we have seen with the virus surging, as you've seen from Dr. Schooley's presentation, we are allowed to teach outdoors, but not indoors. And we are allowed to continue research so long as the research is done with people wearing PPE, keeping distance, keeping the rooms extra clean, and staying at very low density of occupancy of labs. So I think that we are at the greatest degree of restriction due to health orders we've seen, and we're still able to do a little bit of in-person teaching outdoors, and we're still able to continue research. So I think that kind of answers the question.
Thank you, ABC Simmons. Next question is for ABC Jensen. Question is, what advice or best safety practices can you provide for faculty teaching in person?
So I'd start off answering by saying that we now have more than one term of experience teaching in person, indoors and outdoors through this pandemic. And everything that we've seen is that classroom activity following the prescribed practices, masking, distancing, sanitation, are safe. We have not seen here or anywhere else any transmission due to classroom activity. Now, the advice that I would give to someone teaching in person or considering to teach in person is follow those guidelines and be really strict about doing so, and your students as well. The other thing to pay attention to is to pay attention to the activities adjacent to the classroom, things that happen before class starts, things that happen after class starts. Where we've seen some viral activity has been associated with the classes. So after classes, students getting together and going out for lunch or going out for a meal, taking their masks off, basically breaking the rules that we've set. So it's easy when you're in the classroom to be in that mode and to be focused, and it's easy to lose that focus before class starts or immediately after class ends.
Thank you, Dr. Jensen. The next question is for EVC Simmons, and it has to do with what COVID-19 related faculty leave offerings are available now in 2021.
Thanks. So briefly, I can talk about a couple of the status of a couple of federal programs, and then I'm going to put a link in the chat about the full range available. Actually, somebody has kindly put the link in for me, so that's great. So just to remind people, FMLA is a federal leave program that's always available to eligible employees, regardless of the pandemic in particular. There are other federal leave programs under the Families First Coronavirus Response Act, such as emergency paid sick leave and expanded family and medical leave. Those expired at the end of December 2020. Now, the December 27th, 2020 COVID-19 relief bill does allow employers to voluntarily extend those two federal programs that I just mentioned through the end of March 2021. We're still waiting to see whether the Office of the President will decide to continue those programs through the end of March. In the meantime, please look at the leave options page on the academic personnel website, which has been placed in the chat. There are a lot of different leave options and many details about exactly which apply to whom under which circumstances.
Thank you, EVC Simmons. So then the last question for today is for Vice Chancellor Matthews. And this is one of the questions that came in live. And the question is there a list of the 10% of buildings that have not been retrofitted for more cleaner air handling? Vice Chancellor Matthews.
Thank you for the question. I tried to answer it in the chat and I didn't do well. So clearly, yes, it's online. There is a list of those buildings. What I would say is if you're in a building that doesn't have central air conditioning or heating ventilation, then the chances are likely that you do not have the highest level air filtration. So if you have a window air conditioner, as an example, then that building would be in part of that 10%, but there is a list online.
Thank you. Well, that's about all the time we have for today. And I'd like to thank everybody for their questions. We're going to attempt to answer everyone's questions beyond this by updating the FAQ that is on our webpage and posting a recording of this town hall as well. Being conscious of current events, the EVC will be hosting a third installment of the Election 2020 What Now, What Next series this Thursday, January 14th. And I think a link is being put to that in the chat. And that's obviously in our minds because to discuss the violence that occurred at the nation's capital last Wednesday, January 6th, 2021. So I'd like to thank the presenters and all of you, the guests today, for sharing your time and getting the information from the presenters and the panelists today. I thank you, the faculty of UC San Diego, for attending today and continuing to work together as a community to help bring us through these unprecedented times. Also, please complete the post-event survey that's going to be sent to you shortly to help us continue to improve our means of communicating among ourselves during this stressful period. So this concludes the Return to Learn Faculty Town Hall, and the next town hall in this series will be held next Thursday, January 21st at 3 p.m. and that'll be a staff town hall in addition to the election webinar later in the week. So thank you and take care and stay safe.